Continuing right along with our ABCs to natural medicine, we are on the B's, and I want to talk about bedwetting. Actually, bedwetting, we've had a number of children that have come in with bedwetting issues, which can be really embarrassing for them. Again, we've had some people that have had success with a foot baths and a mini program. The foot baths, I think the reason that they work for bedwetting is because the foot baths will send an acupuncture signal through the soles of the feet and stimulate all the acupuncture meridians. So sometimes acupuncture has been a very effective thing for bedwetting, and we've seen good results with the foot baths with that as well. Sometimes bedwetting can be a stress thing, so we would definitely recommend the stress calming factors. Depending on the age of the child, you can go anywhere between 4 to 6 a day with the for bedwetting. Sometimes there's a yeast or a fungal issue with it, so we would recommend the Fungu Cleanse plus the Candida fungus fighters just to hit it hard with both of those. So this would be 10 sprays, 3 times a day. You alternate between 1 and 2. So on the Fungu Cleanse, you would do Fungu Cleanse 1 on one day and Fungu Cleanse 2 on the next day, and the Candida fungus fighters, which would be, again, depending on the age of the child and depending on bowel tolerance, anywhere between 3 to 6 a day. So that's the mini program for bedwetting. Bell's palsy, actually, a mini program for that. In Bell's palsy, some people may not realize it's like when one side of the face droops. It can be a situation where people live with that for a long time. Sometimes it can be a temporary situation. So the number one pick for that is the superfood greens, because it's high in mineral content. So a lot of times the Bell's palsy is actually a mineral deficiency. So, and some people have never heard of that before, but it's when one side of the face will droop. So Bell's palsy, the superfood greens, you can do anywhere between 6 and 12 of these a day in a split dose. And then secondly, you want to do the Whole Food Lively Multi, 3 of those a day with food. And you want to do the triple magnesium, triple calcium at bedtime. So that would be, you know, the stress calming factors probably would be a good thing for Bell's palsy too when I think about it, because sometimes stress, if you can do anything to help support stress naturally, stress always seems like it plays a role with things that are being out of balance. So the triple magnesium would be 3 or 4 before bed. Okay, bipolar, that fits into the same categorizations as depression and anxiety. Those usually are the same deficiencies. So with bipolar, by all means, you want to do the stress calming factors, which you can take anywhere between, again, 4 a day up to 10 a day. Bipolar people, they can be really fun to be around sometimes, unless they're on the downside. Bipolar people can be really kind of hyper. Like, you can recognize sometimes a bipolar person because they're all over the place and, you know, they're the life of the party. But then they can turn on a dime and be like really depressed and not want to get out of their house, and they can be you know, moping about everything, or their moods can just change like that. They can be very, very snappy. So stress calming factors, by all means. This has saved so many problems in families, because it's not going to make problems go away, but it's just how people process the problems. So stress calming factors anywhere between 4 a day up to 10 a day. Your urine will turn yellow with that. And 3 of the Lively Multi with food. So that's 3 Lively Multi, Whole Food Multiple with food. And 4 triple magnesium, triple calcium at bedtime, 4 to 6 to bowel tolerance. So that's a mini program for bipolar. So a lot of times bipolar people too, once they start feeling okay, they think about doing something more when they're in their depressed state. When they're in the hyper state, they don't think about, they a lot of times drop their medications. They think they're doing great, but then right on the other side of that is the downward spiral too. So the biggest challenge for them is staying consistent on a supplement program. Okay, I want to talk about blood sugar issues, because diabetes can be a very serious issue. Of course, most people know there's a type 1 and there's a type 2. The type 2 is a lot more controllable with supplementations and diet. So I'm going to give you the supplement program that we would put somebody on for blood sugar issues if they are a type 2 diabetic. I don't have it right here. We use something called glucose optimizer. You would have to call the wellness center to be able to get that shipped out to you. But it actually really will help to reduce the amount of insulin a person needs. I've had some people that have been diagnosed with type 1, but they respond to a type 2 program. So you can't roll this out for type 1 diabetics either, but this is more for type 2. So the glucose optimizer, when you use it, it will naturally lower the blood sugar, but you do have to make sure you're monitoring blood sugar when you take that, because low blood sugar can be a very serious thing too. So you want to make sure the blood sugar doesn't drop too low. If you're on medications, you may have to adjust your medications, just like you would do if you're monitoring every day anyways, which you really should be if you have any kind of blood sugar issues. So second for blood sugar would be 3 of the lively multi. 3 lively multi. And you want to do 3 healing omegas, which actually healing omegas is really good for any kind of blood sugar issues. Absolutely want to do the Fungu cleanse homeopathy, because there's almost always a fungus connection with diabetes. So matter of fact, there's been books written on it about the fungus and the diabetic connection. So when you're rebalancing intestinal gut bacteria, you always want to do something to destroy the bad guys and to put the good guys back in. So the good guys are the professional probiotics. Again, don't go too cheap on a probiotic. This one has 65 billion live cells. I actually have had this made just for my patients. So 2 or 3 of those a day, and intestinal enhancer, because blood sugar issues is almost always a digestion issue. A lot of people don't realize that. The pancreas and the liver have a lot to do with digestion and digestive enzymes, and those really, if you can support those with an intestinal enhancer with everything, every time you eat food, if you can include 2 or 3 of these for diabetics, that's super helpful. And studies have shown that magnesium and calcium is also great for diabetics. So if you're diabetic and you're really serious about wanting to take charge of your health and do a program, that's the program that we would put you on.